for years. To my knowledge, it seems like it started from this practice in the States known as caring medical. They're the first that I know of to really market and talk about this problem so broadly. And I know this because for years I've had patients talking to me or contacting us saying that they've already been to their website and found this information, or that they've talked to them directly and told they had CCI even though they didn't actually see them in person and it was all virtual. And for almost all of the patients I talked to, when I asked them further questions, it didn't quite fit CCI. So you may wonder, why does this clinic talk about CCI so much and tell everyone that they have it? Because they treat it. They use injections known as prolotherapy. At this point, they aren't the only ones doing prolotherapy, but they're certainly one of the first ones I ever heard of who are talking about it in relation to CCI. Now I hear about other clinics in India and other parts of Asia who are doing prolotherapy for CCI, even if the people doing it sometimes have minimal training. Prolotherapy, by the way, is just a sugar solution being injected into the joint, usually dextrose. Simply, this solution acts as an irritant in the area, creating an inflammatory response so the body is prompted to heal. This is something we can also expect from things like massage, red light therapy, heat therapy, or ultrasound. From the outside, because it's an injection, it looks revolutionary, like it's stem cell therapy. But mechanistically, it's much simpler. And I'm not here to judge it as a treatment. I'm sure for some people, it can be very helpful. Some research suggests that it's not pure placebo, that actually may be helpful with certain joint issues. But CCI is not a normal joint issue. And again, CCI is very rare, so people are scared into thinking they have it. That's just wrong. Anybody who suffers with difficult, complex symptoms over a chronic period and are not getting results with traditional medical care may feel like they have a rare disease. And if a trained doctor tells them that they have something, it tells them very confidently, it may be very convincing, even if there's no proof. So what's the actual cause? There are potentially various different causes, and for me to say it's always not CCI and it's definitely something else would also be unprofessional. They potentially can come from CCI, but it could also be autoimmune issues, it could be inflammatory issues, it could be spinal issues like disc degeneration, it could also be complicated migraines or other causes. One of the most common causes that we see here in our practice is misalignments of the joints in the upper neck. This can produce very, very similar symptoms to CCI, but this isn't an instability, it's an alignment issue. This is much more common and logical, especially if someone doesn't have the risk factors for true CCI. This can also be caused by accidents, but it can also be affected by things like postures, habits, sleep positions, and then worsened by stress or fatigue. And this isn't to say that if it isn't CCI that it must always be a misalignment. There are still other things which may be a potential cause. This is just much more likely and logical based on modern lifestyles. So if you have dizziness, headaches, neck stiffness, fatigue, digestive issues, and you think you have CCI, but you don't have a genetic condition, you don't have a history of extreme trauma, then it's more likely it's going to be misalignments at the top part of the neck, which are much easier to correct. Whatever it is, don't base a diagnosis purely on an article you read, a video you watch, or a call with a doctor or other practitioner, including myself. Get tested, get imaging, be certain, get to the root cause to find out exactly what's going on so you can get control of these symptoms and take